Hello and welcome. Today, we're diving into the world of neurological disorders to explore a rare and often excruciating condition called glossopharyngeal neuralgia. Glossopharyngeal neuralgia, often referred to as GPN, is primarily caused by compression of the glossopharyngeal nerve, the ninth cranial nerve. This nerve is responsible for sensation in the throat, tonsils, back of the tongue, and middle ear, as well as controlling the swallowing muscles and the parotid gland, which produces saliva. The most common culprit behind this compression is an aberrant blood vessel, like an artery or a vein, pressing against the nerve near its exit from the brainstem. In rarer cases, a tumor or lesion along the nerve's path can also be the cause. Sometimes, however, the cause of glossopharyngeal neuralgia remains unknown. This is referred to as idiopathic glossopharyngeal neuralgia. Let's delve into the pathophysiology. When a blood vessel or other structure compresses the glossopharyngeal nerve, it damages the nerve's protective myelin sheath. This myelin sheath normally acts as an insulator, allowing nerve signals to travel smoothly and efficiently. Damage to the myelin sheath disrupts these signals, causing the nerve to misfire and generate intense, sharp, stabbing pain. This abnormal nerve activity typically occurs in the areas innervated by the glossopharyngeal nerve, leading to the characteristic pain experienced in the throat, ear, and base of the tongue. Glossopharyngeal neuralgia is a rare disorder, with estimates suggesting that it affects less than 1 person per 100,000 annually. It is less common than trigeminal neuralgia, which affects the trigeminal nerve. The condition typically manifests in middle to older adulthood, often after the age of 50. There doesn't appear to be a significant difference in incidence between men and women. The hallmark of glossopharyngeal neuralgia is sudden, severe episodes of stabbing or shooting pain. This pain is typically localized to the throat, back of the tongue, tonsils, or ear. These episodes are often triggered by actions such as swallowing, coughing, talking, chewing, yawning, or even touching certain areas of the throat. In some cases, the pain can be accompanied by other symptoms, including changes in heart rate or blood pressure due to the nerve's connection to the vagus nerve, which regulates these autonomic functions. Fainting or seizures may occur in rare instances as well. Diagnosing glossopharyngeal neuralgia involves a thorough neurological examination and a detailed review of the patient's medical history. The physician will assess cranial nerve function to rule out other conditions. MRI scans of the brain are typically performed to visualize the glossopharyngeal nerve and to identify any potential causes of compression, such as blood vessels, tumors, or lesions. A local anesthetic block of the glossopharyngeal nerve can sometimes be used as a diagnostic tool. If the nerve block temporarily relieves the pain, it strongly suggests that glossopharyngeal neuralgia is the correct diagnosis. While there aren't strict classifications or types in the same way as some other conditions, glossopharyngeal neuralgia can be broadly categorized as either primary, when caused by nerve compression from a blood vessel, or secondary, when caused by another underlying condition like a tumor. It can also be classified as idiopathic if no identifiable cause is found. Treatment for glossopharyngeal neuralgia aims to relieve pain and improve quality of life. Initially, medication is often the first line of treatment. Anticonvulsant drugs, such as carbamazepine or gabapentin, are commonly prescribed to stabilize nerve activity and reduce pain. Tricyclic antidepressants may also be used for pain management. If medication proves ineffective, surgical options may be considered. Microvascular decompression is a surgical procedure that involves relocating or removing the blood vessel compressing the glossopharyngeal nerve. In cases where surgery isn't feasible, gamma knife radiosurgery, a non-invasive procedure that uses focused radiation to target the nerve, may be an alternative. Injections, such as nerve blocks with local anesthetics or botulinum toxin, can also provide temporary pain relief. Unfortunately, there are no definitive ways to prevent glossopharyngeal neuralgia. The condition is often caused by factors that are difficult to control, such as the natural course of blood vessels near the nerve. Maintaining overall good health and avoiding activities that trigger pain episodes can be helpful in managing the condition. The prognosis for individuals with glossopharyngeal neuralgia varies. With appropriate treatment, many patients can achieve significant pain relief and improved quality of life. Medication can be effective for some, while others may require surgical intervention. The success of microvascular decompression surgery is generally high, with many patients experiencing long-term pain relief. Research continues into new and improved treatments for glossopharyngeal neuralgia, including exploring novel drug therapies and refining surgical techniques. Ongoing studies are also investigating the underlying mechanisms of the condition to better understand its causes and develop more targeted treatments. Thank you for joining us in this exploration of glossopharyngeal neuralgia. If you or someone you know is experiencing symptoms, please consult a healthcare professional for diagnosis and treatment.